Okay, so welcome to another deep dive. And today we're tackling something that, affects us all, the healthcare system.
Hmm.
It's a beast, right? Complex. Sometimes, honestly, it can be downright frustrating. That's why we've gathered a bunch of insights. We're looking at particularly this one podcast, the Awakened State podcast, and they did this whole thing on 15 potential healthcare nightmares, things you might actually encounter as a patient.
Yeah, and the point of today isn't to just, freak everyone out, right?
Yeah.
We want to really dig into what makes these experiences tick and hopefully give you some, knowledge, some tools so you can
Yeah.
be a little more prepared, a little more able to, advocate for yourself when it comes to your health.
Right. Exactly. So you're not just caught flat-footed when something happens.
Right, right.
Okay. So let's just jump right in. And I think the logical place to start is, well, with the diagnosis. Often that's where it all begins, right? And unfortunately, that's where we find our first kind of point of discussion, this whole thing about misdiagnosis.
Yeah, yeah. And I think what's concerning right away is it's not just the simple oversight. It's the incorrect identification of an actual medical condition. And you got to think about the domino effect here. It can lead to ineffective treatment, delays in actually getting the right care, not to mention just the stress, right? Like the immense stress it puts on you.
No, totally. And it's more prevalent than I think most people realize, right? Like there was this 2014 study by the National Academy of Medicine, and it suggested that most Americans will face a diagnostic error at some point in their lives. That's a lot. It's a pretty widespread issue. So why do you think it happens so often?
Well, there are some inherent complexities in medicine, obviously, like symptoms, they can overlap across all sorts of conditions. So it's a puzzle for healthcare professionals sometimes, right? To really figure out what's going on. But, a lot of times it comes down to the process itself, like how information is gathered, how it's interpreted, how the doctor's ultimately reaching that conclusion. So, you know, sometimes crucial pieces of the puzzle they're just missed, or there might be some biases, even unintentional ones, that are kind of influencing the outcome.
Right, right. And the podcast shared a story that really kind of hit home for me. This friend was initially diagnosed with anxiety, but it turned out they were actually having heart problems. And it took a while, multiple visits, before they figured out what was actually going on.
Oh, wow.
Yeah. So what does that tell us? Like, what does that kind of experience tell us about this whole issue?
I think it really underscores the importance of being attuned to your own body, right? Like, yourself best. So if something just doesn't feel right, if the symptoms keep persisting, or if you just have that gut feeling, then don't hesitate to seek a second opinion. And it's not about distrusting your doctor, right? It's more about making sure that everything is, covered. This, especially if it's something serious, or if it's ongoing, it's like getting that second set of eyes on the problem.
Right, right. Okay. Makes sense. So let's move to an area that's, I think, even more critical and honestly kind of frightening: medical errors and surgical mistakes. This isn't just about the diagnosis anymore. It's what happens during the actual treatment.
Yeah, yeah. And the thing is, with medical errors, it's a broad spectrum, right? It could be something seemingly small, like mixing up medications, to something, well, devastating, like wrong site surgery. And when you look at the data, it's really sobering, because it's estimated that medical errors are the third leading cause of death in the U.S.
Third leading cause. Wow. I mean, that's a statistic that just makes you stop and think. So what kind of systemic issues contribute to errors on that scale?
Well, I think it highlights some of the vulnerabilities, right, within the healthcare system itself. Things like communication breakdowns, during shift changes, or maybe inadequate training protocols, even just fatigue among the staff, or the sheer complexity of some of these medical procedures. It's not about pointing fingers, but understanding where those risks really are.
Right, right. So for our listener, like, what are some practical things that they can do to minimize these risks? The podcast talked about having an advocate present, especially before surgery. So how does that help?
Well, having someone there, a friend, a family member, someone you trust, it gives you an extra layer of vigilance. It's like another set of ears, another set of eyes. They can make sure everything's clear, that you understand the information, that you're asking the right questions, that the protocols are all being followed. So, for example, before surgery, they can help confirm the procedure, the site, making sure all the checks have been done.
Right. They also talked about ensuring that surgical sites are, clearly marked and verified, and not just once, but multiple times. I mean, it might seem obvious, but why is that so crucial?
Yeah, and these preoperative checks, they're specifically designed to prevent wrong site surgeries, which, thankfully they're rare, but they are preventable.
Hmm.
And they can have, I mean, devastating consequences. So your advocate, they can just kind of gently make sure that those steps are being followed. And never hesitate to ask questions yourself. The more you understand the procedure, the more aware you'll be if anything feels off right
Yeah.
leading up to it.
Right. Okay.
Yeah.
Totally. So let's shift gears a little bit to something that I think a lot of us have probably experienced personally: long wait times, whether it's for an appointment or in the emergency room.
Yeah, that's a common frustration for sure. And it really stems from a lot of different factors. There's an increasing demand for healthcare services. There are staffing shortages in certain areas, and then in the ER, you've got the whole triage system, which makes sense. The most critical cases have to be seen first, but it all adds up.
Yeah. Yeah. And there's a 2017 CDC report. They said the average ER wait time was around 30 minutes. But I think if you ask most people, their personal experience is quite different. What's the reality?
Right. Yeah. That 30-minute average, it gives you a general idea, but it doesn't capture the whole picture. In a lot of cities, especially during, peak hours, the waits can be hours long. And it's interesting because hospitals, they're constantly trying to find ways to optimize the flow, right?
Yeah.
But it's this balancing act between being efficient and then also providing, thorough care to each individual.
Right. Right. And more importantly, I think, as the podcast pointed out, these long waits, they can actually be dangerous, especially if you have a condition, where time is really of the essence.
Absolutely. Yeah. For certain conditions, like a stroke or a severe infection, every minute counts. Those delays can mean that you're not getting essential treatment quickly enough, and unfortunately that can impact the outcome.
So if you're in that situation, you're in the ER, you're waiting a long time, what's a takeaway? Like, what's something practical you can do? The podcast talked about alerting the staff if your symptoms get worse. So why is that so important?
Yeah, because you can't assume that the initial assessment that they did when you came in, that captures everything. So if anything changes, if you have new symptoms, or if your existing symptoms get worse, you need to tell them because they might need to reevaluate you based on that new information. And I think it's also worth mentioning in non-emergency situations, telemedicine is a really great option these days. You can consult with a healthcare provider remotely, which can save you that trip to the waiting room.
Right. Yeah. Telemedicine has really, really changed things. Okay.
Yeah.
So let's move to another topic that I think causes a lot of anxiety: unexpected medical bills.
Oh, yeah, that's a huge one. It's a pain point for so many people and a real financial burden. And surprise bills, they can pop up in different ways. Like maybe you unknowingly get care from an out-of-network provider, even though you're at an in-network facility, or maybe you get hit with these unexpected charges for tests or procedures. It's tricky.
Yeah, and the statistics are pretty alarming. There's a 2019 Kaiser Family Foundation study, and it found that nearly 1 in 3 Americans have medical debt. That's a lot of people struggling with this issue.
Yeah, it is. And it really shows you how complex and often how lacking in transparency our healthcare billing system is. It makes you think about patient financial protection, and the need for clearer pricing up front.
Yeah, for sure. So what can you do? Like, what are some steps you can take to try and avoid these surprises? The podcast talked about, verifying if a provider's in network before you get care. I mean, that sounds simple enough, but is it always that straightforward?
It should be simple, but it does take a bit of diligence. So before any planned procedure, even a specialist visit, you really should contact your insurance provider and the healthcare facility just to confirm everyone's network status, the facility itself, the surgeon, the anesthesiologist, everyone. And getting that written cost estimate for planned procedures, that can give you some peace of mind. At least you know what to expect financially.
Right, right. And what happens if, despite your best efforts, that unexpected bill shows up?
Right.
The advice was, don't pay it right away, request an itemized bill, and really scrutinize it for errors.
Yeah.
So what should you be looking for?
Exactly, because billing errors happen more often than you might think. So you get that itemized bill, and you go through each charge carefully. Compare it to the services that you actually received. Look for duplicate charges for things you didn't actually have done, or even discrepancies in the codes they're using. If anything seems off, contact the billing department right away and dispute it.
Right. Okay. Good advice. So let's move on to something that really affects how much you understand your care and how much you trust the process. Poor communication from your healthcare providers.
Yeah. I mean, good communication.
Yeah.
That's the foundation, of quality healthcare. And when doctors or other providers, they don't explain things clearly, like the diagnoses, treatment options, care plans, all that, it leaves patients feeling lost, anxious, and ultimately less in control of their own health.
Yeah. The podcasts talk about how sometimes, doctors use all this jargon and they give these rushed explanations and it leaves people feeling, I don't know, intimidated. Like they can't even ask questions.
Right, right. And it creates this power dynamic that isn't helpful. The medical professional, they have the specialized knowledge, and it's on them to bridge that gap and explain things in plain language. It makes you think about how much emphasis is placed on communication skills during medical training.
Right. Right. So for the listener, what can they do to encourage better communication? Bringing a notebook to appointments, some
Oh,
suggestions so you can jot things down, and any questions that come up. And also, not being afraid to ask your doctor to explain things simply. That's huge, right?
absolutely. You have every right to understand what's going on with your health. So never feel embarrassed or intimidated to ask them to clarify, to repeat things, to use different language. Sometimes asking for an analogy or a real-world example, that can make a big difference. And I think it was even suggested to record the appointment with the provider's permission, of course, so you can go back and listen to it later.
Right, right. Okay. Good tips. So let's talk about, when you're seeing multiple providers and maybe the communication between them isn't so great, this whole idea of fragmented care.
Yeah. I mean, these days it's common to see multiple doctors, especially with specialists and all that, and the coordination between them, that's so important. But when that communication breaks down, when they're not talking to each other effectively, well, it can lead to, duplicate tests, conflicting treatment plans, and ultimately it's not good for the patient. You're not getting the most effective care.
Yeah. And there was a 2016 study in the Journal of Patient Safety that really showed how this lack of coordination can have a negative impact on the outcome for the patient. Yeah. What are some of the specific consequences?
Well, it can lead to delays in treatment, which is obviously never good.
Yeah.
It can increase the risk of medication interactions because no one doctor has the full picture of what you're taking. And honestly, it just adds stress and confusion for you. As the patient, you're trying to piece together all these different recommendations. And, electronic health records, they were supposed to be a solution to this, but the reality is the implementation and how well they talk to each other hasn't always been as smooth as we hoped.
Right, right. So what can you do as the patient? What role can you play in improving this coordination? The podcast suggested asking your primary care physician to be the central coordinator.
Yeah.
So how effective can that be?
Your primary care physician, they often have the most holistic view of your health. So they can definitely play a big role in facilitating communication between all the different specialists you're seeing. And it's also helpful to keep your own detailed records, like a list of all your medications, test results, the recommendations each doctor gives you. That way you have all that information in one place and you can make sure everyone's on the same page.
Right,
Yeah.
right. Okay, so let's move on to another concern that's specific to being in a healthcare facility, hospital-acquired infections.
Right. So these are infections that you can get during a hospital stay or as a result of a medical procedure. And they can range from, relatively minor things to really serious, even life-threatening infections.
Yeah, and the CDC actually estimates that about 1 in 31 hospital patients has at least one of these infections on any given day. I mean, those are pretty alarming numbers.
Yeah, it really underscores the importance of those infection control practices in hospitals. Things like proper hand hygiene, thorough cleaning, and making sure they're following sterile procedures during any kind of medical intervention.
Right. So what are some things, some simple things you can do as a patient to protect yourself? The podcast said, don't be afraid to ask healthcare workers if they've washed their hands. I mean, that's a pretty straightforward one.
Yeah. It's a simple question, but it's a good one to ask. They should be doing that anyway, but as a patient, you absolutely have the right to make sure that they are. And also, don't be afraid to ask about the hospital's infection rates for specific procedures. That data is often available, and it can help you make an informed decision about where to go.
Right. Okay. So another area where errors can have really serious consequences, medication errors.
Yeah. And this covers a lot of different things. It could be prescribing the wrong drug, the wrong dosage. It could be errors in dispensing at the pharmacy, or even errors in administering the medication either at the hospital or at home. And these mistakes, they can lead to, drug interactions. They can make the treatment ineffective. And sadly, they can even be fatal.
Right. And the Institute of Medicine, they estimated that medication errors harm something like 1.5 million people every year in the U.S. I mean, that's a massive number.
Yeah, it shows you how complex the whole medication process is. There are multiple steps involved, and each one is an opportunity for error. It's interesting, though, because technology is playing a bigger role these days. Things like electronic prescribing and barcode scanning, they're helping to reduce those risks.
Okay, that's good. So for our listener, what can they do? Um, Double checking your prescriptions when you pick them up at the pharmacy. That seems like a pretty basic but important step.
Oh, absolutely. Before you leave the pharmacy counter, make sure that the name of the medication, the dosage, the instructions, it all matches what your doctor prescribed. And it's a good idea to keep an updated list of all the medications you're taking. Include over-the-counter stuff, supplements, everything. And share that list with every healthcare provider you see. That way, you can avoid those potentially harmful interactions. And if the medication looks different than usual, don't be afraid to ask the pharmacist about it. Just make sure it's the right thing.
Okay, good advice. So let's talk about something that I think is particularly sensitive and important.
Mm.
And that's when your symptoms are dismissed or minimized. And the podcast talked about how this can disproportionately affect women and minority patients.
Yeah, and this is a big problem because it's rooted in societal biases and these inequities within the healthcare system itself. And research has shown that women's pain is often underestimated compared to men's. And racial and ethnic minorities, they can experience disparities in diagnosis and treatment because of biases that healthcare providers might have, even if they're not aware of them.
Right. Yeah. And the podcast really emphasized that if you feel like your concerns are being dismissed or minimized, you need to be persistent. You need to document your symptoms really well and not hesitate to get a second opinion. Is there anything else you can do in that situation?
Yeah, I mean, you have to be your own advocate. Keep a detailed log of your symptoms, when they started, how they've changed, how they're impacting your life. That documentation, that's really powerful, can help you explain what you're going through and think about bringing someone with you to appointments, a friend, a family member, someone you trust. Having that extra support can make a difference. And if you consistently feel like you're not being heard, then it's okay to find a new provider, someone who you feel listens to you and respects your concern.
Right. Right. Makes sense. Okay. So let's touch on another issue that's become more and more relevant these days. Privacy breaches.
Yeah. With electronic health records, the risk of having your information accessed or disclosed without your permission, that's definitely increased. And these breaches, they can happen in different ways. Hacking, ransomware attacks, even just human error. It's a concern.
Yeah. And there was this statistic from the HIPAA Journal. Over 41 million people were affected by healthcare data breaches in 2019. I mean, that's a huge number.
Yeah, it is. And it shows you how vulnerable our digital health information is. And the consequences can be really serious. Identity theft, financial fraud, even just the emotional distress of having your private information out there. It's important for healthcare organizations to have those strong security measures in place to protect patient data.
So what can you do? Like as a patient, what are some steps you can take?
Mm.
The podcast suggested reading those privacy notices
Yeah.
from your providers and asking them about their data protection practices
Mm.
and being cautious about sharing information on apps that aren't covered by AI. What does that mean, like in practical terms?
Right. You want to know how your information is being stored, used, shared. So take the time to read those privacy policies from your healthcare providers and any health-related apps you're using. And be especially careful about sharing sensitive information on apps that aren't subject to IAPA regulations because they might not have the same level of protection. And remember, if you think your privacy rights have been violated, you can file a complaint with the Office for Civil Rights.
Okay, good to know. So another thing that I think a lot of people find frustrating, those rushed appointments where it doesn't feel like you have enough time to really talk about what's going on.
Yeah. I mean, doctors, especially in primary care, they're under a lot of time pressure. So the appointments are often short. And that doesn't work well if you have complex health issues or multiple concerns. And there have been studies showing that the average primary care visit is pretty brief, and that can definitely affect how well you're able to communicate with your doctor.
Right. Right. And the podcast had a good tip for this. Prepare for your appointments. Like, write down your main concerns beforehand and let your doctor know right at the start what you want to talk about. So how does that help you make the most of that limited time?
Well, it lets you prioritize, right? You're making sure that the most important things get addressed. And if you don't think you're going to have enough time, don't be afraid to ask for a longer appointment or a follow-up visit to discuss anything else.
Right. Okay. So let's talk about accessing your medical records. It seems like that should be easy, but sometimes it's not.
You do have a right to access your records, but sometimes the process can be a bit of a hassle. Bureaucratic hurdles, technical issues with patient portals, or just a lack of clear information about how to request them. It can be frustrating.
Yeah. And there was a study in 2018 in the Journal of Medical Internet Research, and they found that a lot of patients really do struggle with those patient portals and those online systems that are supposed to give them access. So why is it sometimes so difficult?
Well, those portals, they're convenient for certain things, but they don't always give you the full picture. And they can be hard to navigate, especially if you're not very tech savvy. It's important to know what your rights are regarding access, including any fees you might have to pay to get copies. And if you're having trouble, just ask the staff at the medical office. They should be able to help you.
Right, right. Okay. So language barriers, that's another really important issue.
Yeah. When there's a language barrier between the patient and the provider, it can cause a lot of misunderstandings about the diagnosis, the treatment, the care plan, and that can have serious consequences.
Yeah. And the podcast talked about how the Joint Commission, the organization that accredits healthcare facilities, they emphasize how important it is to provide language services.
hmm
So what are your rights as a patient if you don't speak the same language as your doctor?
Well, healthcare facilities, they have a responsibility to provide qualified interpreters for patients who need them. And hospitals that get federal funding, they're actually required to do this for free. So as a patient, you have a right to ask for an interpreter. And while it's great that family members or friends might offer to help, it's really better to use a professional interpreter because they have the medical knowledge and they can make sure that the communication is accurate and unbiased.
Right, right.
Yeah.
Okay, so let's move on to something that I think is often overlooked, a lack of empathy from healthcare providers.
Yeah. I mean, we all want our doctors to be skilled, obviously. But empathy and compassion are also really important. When you feel like your doctor isn't listening or that they're not treating you with respect, it can really damage the relationship. And that can make you less likely to follow their recommendations, and that's not good for your health.
Right, and the podcast said that if you consistently feel this lack of empathy from a provider,
hmm
you might want to find a new one. So is it really that impactful?
It can be. The doctor-patient relationship, it should be built on respect and understanding. And if you don't have that, then it's perfectly reasonable to look for someone else who you feel more comfortable with, who listens to you, who supports you. And I get it. Healthcare providers, they're under a lot of pressure. They can be burned out, but that should never be an excuse for treating patients poorly.
Right, right. Okay. And finally, let's talk about unnecessary tests or treatments.
Yeah. Sometimes in the healthcare system, there are financial incentives to do more rather than less. So there's this potential for patients to be recommended or even pressured into tests or treatments that they might not really need. And that can lead to extra costs, unnecessary anxiety, and even potential risks from the procedures themselves.
Right. The podcast mentioned a study from 2017 in JAMA that estimated something like 20 to 30% of healthcare spending in the U.S. is wasteful. And that includes those unnecessary services.
Mhm.
So how can you tell if a test or treatment is really necessary?
You got to be informed and you got to be engaged. So before you agree to anything, ask questions. Ask about the benefits, the risks, what would happen if you didn't do it. Getting a second opinion can be really helpful too, especially if it's a major procedure. And pay attention to how your doctor reacts when you ask these questions. If they get defensive or resistant, that could be a red flag.
Right. Right. Okay, so we've covered a lot today, and we've talked about some pretty challenging stuff. And I think the main takeaway, as the podcast emphasized, is that knowledge is power. The more you understand these potential pitfalls, the better equipped you are to navigate the system and advocate for yourself.
And it's important to remember that, while we've talked about some negative things, the vast majority of healthcare professionals are good people. They care about their patients, and they want to provide the best possible care. But it's good to be aware of these challenges so you can be more proactive.
Exactly. So to our listener, we encourage you, ask questions. Consider bringing an advocate with you to appointments. Keep good records of your health information And most importantly, trust your instincts.
Maybe a final thought to leave you with. Think about all the things we've talked about today. Which one of those potential nightmares, resonates with you the most? Maybe it's something you've experienced, maybe it's a concern you have. Thinking about that can help you figure out how to navigate those specific areas more effectively in the future.
That's a great point. Okay, well, thanks for joining us for another deep dive.
You get that?
We'll see you next time.